Hi everyone, my name is Akanksha and my project is on healthcare fraud detection. So I'm doing a project on healthcare fraud detection, and it is a significant issue in the United States that costs billions of dollars annually. It affects the patient and healthcare providers alike, and according to NHCAA, healthcare fraud cost around $68 billion in 2018. Fraudulent activities can also take like various forms such as billing for services that were not provided, performing unnecessary medical procedures, and falsifying medical records. These activities not only lead to financial losses, but they also undermine the quality of patient care by diverting resources away from legitimate medical needs. Healthcare fraud can also result in legal and reputational risk for healthcare providers. Therefore, it's an important issue to be worked upon because it is crucial for ensuring the integrity of the healthcare industry. So, healthcare data is the most complex data to work with. So, the problem is that with healthcare data, it can take various forms and formats, and the data is often dispersed across multiple sources, including the data from your healthcare provider, insurance companies, government programs such as Medicare and Medicaid, and because of the multifaceted view of this data, it gets abundant really quickly, and with millions of healthcare transactions that are happening each second, it gets there is a vast amount of data being generated by all these sources and in all these formats. So this data gets further complicated by the fact that it comes in both structured and unstructured format, and it could be present in the form of a flat file or an image or a video and even other formats. So with the sheer amount of data, it's impossible for just going by traditional analytical methods to process and analyze this data in a timely manner, and this can further delay the process of detecting fraud activities as they occur. So our proposed solution is to combine the traditional methods with our big data solution. So we will integrate both our structured and unstructured data in order to analyze this data efficiently and to detect these fraudulent activities in real time as they occur. And it so we can leverage Apache Hadoop or Apache Spark along with our traditional data warehousing or database solutions like HDF by utilizing HDFS or making a data warehouse and standardizing the data from both the sources, and then building a data warehouse on top of it to be present for analysis and detecting the fraudulent activities further. So on this slide, you can see the pictorial representation of our proposed solution. And in the previous slide, we have already established that healthcare data in general is very complex and is dispersed across various sources. And because of that, it's very difficult to extract meaningful insights. So a workaround that we are providing with our solution is to integrate both the structured and unstructured data. And what this will do is, by integrating both of these data, we will be able to get a comprehensive view of healthcare fraud patterns. And we are also leveraging big data technologies like Apache Hadoop and Apache Spark. So this will help us to process and analyze this large volume of data in real time. And in this particular fraud detection scenario, we know that there's a vast amount of data that is being generated by the health providers, insurance company, government programs, and even like unstructured data sources like social media and EHR. So because of the complexity of the data, we will require a solution that is faster in nature, that is versatile in nature, and that is able to do a real-time detection and report it to the authorities as soon as the trends and patterns are recognized. So we will be able to leverage that by using the Spark streaming MLib, which is a machine learning library wherein you can perform different machine learning algorithms to detect those trends and patterns. And we will also be able to utilize Spark SQL for the structured data for these trend detection. And by doing that, we will be able to investigate suspicious claims and providers further, and this will help in the recovery of fraudulent claims and detect future fraud activities. So overall, our solution is flexible and scalable, and we designed this to be applicable to a wide range of healthcare fraud detection scenarios. So what this means is it can be tailored to meet the needs of different organizations that are in the healthcare ecosystem, and it is very versatile like that, and overall it's going to help the healthcare industry as a whole. The CAP theorem states that in a distributed system, it's impossible to guarantee consistency, availability, and partition tolerance simultaneously. So, when it comes to healthcare fraud detection using big data technologies and machine learning, our focus is on achieving high availability and partition tolerance, but we had to compromise on the consistency aspect of the solution. So, this particular solution prioritizes high availability and partition tolerance, meaning that it is designed to continue operating even in the face of network failures or other disruptions. But it is important to also um, note that while we prioritize those two aspects of the CAP theorem, we will do it at an expense of consistency. So our system may not always provide real time or completely accurate data. So let's explore why our proposed solution is more effective than the traditional approaches to healthcare fraud detection. So, traditional approaches like rule-based systems and manual reviews of claims data, they are limited in their ability to detect sophisticated fraud schemes, and they are only able to catch a small percentage of fraud cases, leaving a significant amount of these activities undetected. But in a study that was conducted by the Healthcare Finance Management Association, they found out that the machine learning algorithms had a 96% accuracy rate in detecting healthcare fraud, and these algorithms can identify patterns of fraud in healthcare data by learning continuously from the historical data that they are fed, and they adapt to these new schemes as they emerge. And because they are able to learn from that data, they are also able to create a model and can predict future um, activities, and they can identify and detect those patterns and can project to make on projections about projections about when those fraud activities can occur, even like in what locations that can occur, or through which medium that can occur. So because of these new big data technologies, we are able to keep up with the fraudsters coming up with new schemes every day, but traditional approaches lack there, and they are not scalable and adaptive like that. So that's what gives our proposed solution an edge over those traditional approaches. So here is a full implementation graphic of the solution, and once the data has been integrated, we can start analyzing it to identify any unusual billing patterns, or identify fraud claims, or identify any providers with high risk of engaging in such fraud activities. So we will use Spark streaming to process data in real time and then identify these potential fraud cases. And some examples of the machine learning algorithms that we can use is, for example, to detect unusual billing patterns, we can use anomaly detection algorithm like clustering, regression, classification. And these algorithms can identify unusual patterns in the data that may indicate of any kind of fraud activities. And we can use rule based algorithms that can identify the claims that violate any specific rules or guidelines. So, an example of that would be like claims for procedures that are not typically performed together, or maybe claims for procedures that are performed too frequently. They can indicate fraudulent activities. And another example could be to use streaming and analytics to monitor social media platforms for any kind of fake reviews, or identifying individuals who are promoting or involved in any fraud activities. And to identify providers with a high risk of engaging in those fraud activities, we can use algorithms such as decision trees, for random forest, support vector machines, and these can analyze the provider data and identify providers with a high risk of engaging in those activities based on their past behavior patterns. And the results of this fraud detection can also be used to investigate suspicious claims and providers further, and this can help in the recovery of fraud claims, and it can deter future fraudulent activities. So after this step, we can use a dashboard or some kind of reporting tool to visualize the data and highlight any suspicious behavior, such as sudden spikes in the billing amount or unusually high number of claims. And we will also use predictive analytics to identify providers with a high risk of engaging in fraud activities, and also prioritize investigations accordingly. So overall, the proposed solution for healthcare fraud detection using Apache Spark is a game changer, and it promises to revolutionize the way healthcare providers, insurance companies, and government agencies detect and prevent fraud. And by integrating structured and unstructured data, our solution will improve fraud detection, it will enhance the efficiency and accuracy, and it will also improve patient safety. It will increase um, patients' overall satisfaction in terms of healthcare, and it will also help to restore trust in the healthcare system, and it will ensure that the patient receive quality care that is not compromised by any fraudulent activities. So that will be my presentation. Thank you so much for listening, and have a good day.